All right, good evening. Thank you for joining us for our regular Thursday evening EMA talking points in response to our community's response to the COVID-19 pandemic. This evening, we're going to change it up just a little bit and have a Q&A format. Late last week, we put out a survey online on our social media page and asked you what questions you had for us. And this evening, I have with me Sheriff Don Phillips, City Administrator Phil Rath, Public Health Director Linnell Deers, and Mayor Tom Lazio, who will each answer questions that you provided to us. But to begin, I have a few things to cover and a few questions for myself as well. Yesterday, on May 6th, Governor Reynolds signed a new proclamation continuing Iowa's public health disaster emergency and allowing more businesses to reopen. Dentists can begin seeing regular patients provided they follow guidelines from the American Dental Association. Campgrounds, drive-in movie theaters, tanning facilities, and medical spas may also reopen May 8th following rules set by the Iowa Department of Public Health. Governor Reynolds will also allow schools to begin the 2021 school year before August 23rd if they so choose, and alcohol licenses set to expire will be extended to the end of the disaster proclamation. First question I want to address that we've received lately is why the discrepancy in the numbers reported by my agency and the Iowa Department of Public Health. So as you're seeing testing ramp up and the numbers increase, and the governor talks quite frequently about the large number of tests being done at the Iowa State Hygienic Lab, there's just a lot to keep up on for all the state partners and the private labs. So that data is aggregated at the State Department of Public Health and then validated by local public health. And so what we're seeing are some things like duplicate cases reported, and those are just the clerical types of things that happen in these types of events. So those things are being resolved. There's constant conversation between a local public health office and the state public health office, and we should see that get more aligned. But I can tell you that the reliable data that represents truly our numbers in Wapello County is what's reported by Wapello County Public Health on the Wapello County Emergency Management website, wapelloready.org, and we update that every morning by 10 a.m. So a little bit about emergency management. I've had some questions about that. A lot of folks are unfamiliar with emergency managers because most days we work behind the scenes on preparedness and capability building. It's really in these types of disasters we come front and center to do what it is that we do. So I, as emergency manager, report to a commission, and that commission is made up of the mayor of every community in this county, representative of the board of supervisors, and our elected sheriff. And the reason I answer to those folks is they're our chief executive officers, and it is their duty and responsibility to keep order in our communities and navigate us through times of disaster. Iowa Code Chapter 29C lays out the requirement for that commission to hire a full-time coordinator to be the resident expert on all things disaster, be their chief advisor, and step up and lead during incidents like this. So you're seeing emergency management be the face of this on behalf of them, and to be the tight at the hip partner of Wapello County Public Health, because this is not the normal type of disaster that we're used to seeing. When you say disaster, we think of things like tornadoes, floods, maybe even terrorism events, but we rarely think of a public health crisis, and they're not really common. And frankly, they're quite scary as we're all living through it. But pandemics are something that we've planned for. Linnell can tell you that we've been to a lot of meetings, a lot of exercises, a lot of things in the last several years to prep for this kinds of thing. We work with a local healthcare coalition. We work with a regional healthcare coalition. Director Deers has been out to the National Preparedness Center in Anniston, Alabama, multiple times to study this exact type of incident. So I feel very confident in her leadership, and I'm happy to partner with her and support her through this mission. So a little bit about that local coalition structure. When I reference the County Healthcare Coalition, I speak of a group of 25 different agencies in our community that provide medical services. And we're talking the Tumble Regional Health Center is our hospital, long-term care facilities, assisted living facilities, the 10 clinics in our community, emergency medical services, fire departments, dialysis centers, people of that nature. And we meet regularly on an everyday basis to plan, prep, share best practices, stay in communication. Since this crisis has started, we've been meeting every week. And really it was that group that determined what our community response to this pandemic was going to be. Our very first address from here at City Hall explained to you that we were going to ask you to call your local primary care provider. And if you didn't have one, you are welcome to call any of the clinics in town. And we've been pushing out graphics and flyers with those numbers on it. That is still the plan. We're publishing a brand new one today because the symptom list has been updated from the CDC as of May 3rd. As this virus has evolved, we've seen different symptoms. It's a learning process. We learn what the symptoms are and aren't. They've changed a little bit since what we first thought. And you know where we glean that information is the follow-up phone calls that local public health does. That's why it's so important that good information is given to the provider, that we can get into contact with those positive tested patients and have a conversation with them to learn about what their symptoms are. And I'm sure Linnell will touch on that a little bit later during her questions. So just a few questions for me as the emergency manager. First public question. What are you doing to protect our nursing and assisted living facilities here in Wapello County? I think I may have already answered that question. So we facilitate weekly meetings of the Healthcare Coalition. We maintain constant contact with their directors. And oftentimes we'll have special meetings even outside of the normal weekly meetings to address specific topics, needs and concerns in those facilities. I've been working very hard myself on providing the PPE that's necessary, filling those gaps on the personal protective equipment. And we've had really good support from our community. We have several people that have been sewing masks for weeks and weeks and weeks. And people brought in donations to public health, to the law center, to facilities directly. And we've had great support from the state Department of Homeland Security Emergency Management to leverage state resources to provide PPE. Second question, does the emergency management team have the power to tell restaurants to not allow in-restaurant dining and only takeout or curbside delivery if the local virus counts continue to rise, despite the governor's current order of allowing them to be reopened? The answer is no. So the emergency management agency is not an enforcement agency. That's law enforcement. So our sheriff, our police department, our county attorney are the ones that enforce those things. Their position, I met with them early on to discuss this, and their position and approach is going to be that of education. So they are going to go out, have conversations with these business owners, make sure they understand what the rules are as according to the governor's proclamation. Then if there's no compliance after that or no spirit of cooperation, then they'll take it to the next level as necessary. I haven't heard that that's a problem. Most of our business owners are very willing to cooperate and do what makes sense and to work within the rules, but the governor's proclamation is the rule. And a little bit about proclamations. Disasters can be small ones and large ones. So they can be an isolated tornado to our community where the mayor might make a proclamation for the city. It could be countywide where the board of supervisors make a proclamation that affects the county. But in large scale disasters that we've seen actually a lot of with the massive flooding in recent years and this public health pandemic, it's been more common that the governor steps up and makes a proclamation for the entire state. So that makes that unnecessary for us to do a local declaration. But whatever that proclamation is by those officials is the rules during that disaster declaration. Next question. I noticed that the info release shows someone should seek medical help if they show certain difficulties, and they're referencing the flyer I mentioned. One of those was if your lips or face are bluish, will you consider changing that to include more symptoms of cyanosis? Cyanosis is a medical term to mean bluish lips or face. Also, will you consider adjusting the testing criteria to allow for more testing and also the criteria for hospital admission? So these questions are in reference to a recent case that was in the media where the person's acquaintance who died from COVID-19. So we are learning about this disease every day, as I mentioned, and we learn more and more about what the symptoms are and aren't and what's more common. The ability to test is changing, and clinicians are figuring out ways to treat it. We're still new into this. You know, diseases sometimes takes years to study and figure out and develop vaccine. So what we do in terms of publications, the Emergency Management Office on behalf of Wapello County Public Health is follow the recommendations from Iowa Department of Public Health and the Centers for Disease Control. So we're not just making this stuff up locally. We're trusting the experts like Dr. Fauci and those folks. In terms of hospital admission criteria, that policy is really directed by their institutions. So that's the questions I had and the material I wanted to cover with everyone. And I'm going to start with questions for our Sheriff, Don Phillips. Sheriff, what steps have been taken to keep our officers safe?
Well, the one thing we've implemented is when officers begin their shift, when they come into work, they'll take their temperature. We've even asked them if before they get at work to check their temperature at home to make sure they're not running a fever. If they have a fever or not feeling well, we'll send them back home, and then they have to be 72 hours before they can return to work fever-free without the use of any medication. We've given all the officers gloves, mask to wear. When a citizen calls dispatch, there's a number of screening questions we ask them to assure their safety, as well as the first responders if it happens to be a medical call that's being called in. So there's those questions are asked so they can let the officers know if there's they need to take some extra precautionary when they show up there. Officers are encouraged to take care of anything by phone if they're able to, and if not, to maintain a 6 feet or more distance. That's pretty much the sum of them.
Second question is, are officers tested? And if so, how often, given that someone could be asymptomatic?
If somebody thinks they've been exposed, obviously we encourage them to watch their health, watch for a fever, watch for any of the symptoms. And if they do have something, then we can get them tested. If their own physician thinks they need to be done, they can have that done. We currently, the Sheriff's Office hasn't had anybody tested as of right now.
How does county and city agencies work to assure that businesses are following the recommended measures to secure customer safety?
So the Sheriff's Office, as well, I'm sure the Tacoma Police Department, are following up with any complaints that we get of anybody being open to the public and not following the governor's orders. We use this opportunity to educate folks and let them know about the requirements of the governor's orders and to work with them to assure they're meeting are safely following those recommendations. So basically, we try to educate and warn them. We certainly don't want to have to enter into arresting somebody or writing citations, but we've had a few, and those folks have complied, and it's kind of a misunderstanding, each one of those. So it's been good so far.
And oftentimes they appreciate the education, don't they?
Yeah, I think sometimes the language in the governor's orders can be kind of confusing to some. So, we've had to reach out to Ruben Nuff with the county attorney, even get some clarification for ourselves at times. So they understand when we explain it to them, and they certainly do comply. So it's good.
And that's a good point the sheriff brings up. We've had to deal with that in the EOC as well when we get questions regarding can they or can't they. And so we refer to the sheriff or the county attorney for clarification, because most of us aren't used to reading legalese and those proclamations. Next question for you, Sheriff, is what precautions do law enforcement officers take when they're on patrol?
Well, as I said, each officer has been given masks and gloves as well as face shield, and they very well could be wearing that when they show up at your residence or your business. Again, they maintain the social distancing if able. And typically, law enforcement don't get real close to folks when they're visiting just for their safety. So we're pretty used to maintaining the 6 foot distance.
So we've heard some recent news in other parts of the state about COVID getting into some jails. So I have a question here. What precautions are being taken in our jail?
Say that again.
What precautions are being followed in the Wapello County Jail?
So when this all started back, was it April or
early March?
Early March, thank you,
It seems like forever.
When it started in early March, we immediately started to screening folks coming into the jail, taking their temperatures, and watching them obviously closely. As our first case come about here in Wapello County, we started doing that out in the Sallyport, which is the garage attached to the jail. So when whether it's a Ottumwa Police Department or the Sheriff's Office or State Patrol brings somebody in, we take their temperature. We'll ask them a series of screening questions to try and determine if we believe they've been exposed. The correctional officers also watch this person to watch their breathing to see if there's any issues with it. When they're brought in, then they are in a quarantine or isolated in a single cell by themselves so that they can not be around other people.
And you released a statement here recently that you've been able to secure a grant and leverage some money to do some upgrades on some of that environmental cleaning.
Yeah, so Department of Justice sent out a deal to the National Sheriff's Association, which I'm a part of, and they sent it out to us in an email. We were one of 15 counties in the state of Iowa that qualified for this grant. It was approximately $58,008. So the Chief Deputy, Marty Wonderland, and I worked on that. We were able to put that together, and we sent that off, and we got approved. We got the approval on April 17th. What this grant does is allow us to buy PPE equipment. We're looking to buy 2 electrostatic, they're called Clorox 360 machines, which is similar to the one that we had borrowed from Eddyville-Blakesburg School District. We're ordered 2 of those as well as product for 2 years. We also have on there some overtime that we can utilize. So if we have some folks, God forbid, if we had some folks get exposed to this, it had to be off, and we had to have some folks work overtime, we could do that. We have that money available. Also, we can pay overtime for cleaning, extra cleaning to be done. We're doing that on a regular basis as well. Every 2 hours, staff is cleaning their work areas or the common areas within the jail and the office.
So there's some activity around the Law Center, a little bit of construction. As public buildings have been closed down, you've, like other offices, found creative ways to still serve citizens. Tell us about what changes are coming to the Sheriff's Office.
Well, what we've done is, I think unfortunately this is probably going to be a virus that's going to be around for a while. So we've had to take some extra precautions. Back in April, maybe late March, we had shut down the Law Center. You still have access into the front area there, but you can't just come up to the second floor as you've been able to do in the past. What we're doing is we know at some point we're going to open this up. So Ottumwa Police Department as well as the Sheriff's Office is having some, it'd be 1/4-inch plexiglass installed at the counters so we can still conduct our business with the citizens, but provides that barrier between the citizens and the staff to help protect them. So at some point, I'm sure the Law Center will be opened back up, and we will be ready for that.
So quite a bit of that traffic is folks coming in to renew their weapons permit. You have another option for that now.
Well, they can currently go to wapelcounty.org and log on there, or go on there and print off a permit application, whether they want a permit to acquire or a permit to carry, and do a color copy of their driver's license as well as their training, or a copy of their current permit and payment, and mail that into us. What we're doing is the Board of Supervisors last week, as well as, and I just got the contract from the auditor's office, and the chairman, Brian Morgan, signed off on it after they approved it, and we sent that off. We're working with the company. It's a web-based system to allow them to fill out the report on there, do those attachments with the color copy of your driver's license as well as your training, and then they can pay with credit card or debit on there also. There'll be a $4 convenience fee for the company that we're working with. That's their payment for helping getting us organized and doing that. So it's really a good opportunity. This is something that this kind of made us look into it, because we've always had people coming in to the Sheriff's Office. So I think this is going to be a good thing. It's the same website that Polk County, a couple other counties throughout Iowa use also. So that's what we're working on. And you'll still be able to come into the sheriff's office and fill out the application there if you want when we open back up. But this gives the opportunity to those folks who work during the day and can't commonly get into the office. This will give them the opportunity to do that online. So it's a good thing.
Bit of a silver lining in all this, actually increases serviceability.
And I would agree with you. I think unfortunately, this has made us kind of have to figure out different ways to conduct business, but I think it's a good thing too that we have been able to discover other ways to conduct business and still get it done.
Sounds great. What other advice do you have for us, Sheriff?
Well, it's the same ones that we've been preaching here for the last couple of months. With our COVID cases rising here in Wapello County, I think we strongly recommend that the citizens take personal responsibility for their health and the health of other citizens and continue to follow the public health directives and social distance and maintain your hygiene.
Thank you, Sheriff, and thanks for your leadership and involvement with us and all this. And crime doesn't stop either, so I know that you're dealing with that every day as well. So it's neat to see how forward-thinking you and your staff are and keeping things moving. Next, we have City Administrator Phil Rath that's going to discuss with us what's happening in the city, and I have some questions from the public for him. First question, Phil, is how is the city working to assure that businesses are following the recommended measures to secure customer safety?
Well, first, I'd like to say that I feel Ottumwa businesses have really been great to work with. As Iowa shifts toward reopening the state's economy, we see that the proclamations are updated and changing right now on a weekly basis, it seems. And one of our responsibilities is to help educate and explain, as Sheriff had mentioned, what the terms of those proclamations are and what they mean for businesses and what they're able to do. Business owners are needing to make a decision. Just because the proclamation may say that they can operate doesn't mean that they necessarily need to or should. They're having to weigh those decisions based on their own economic impacts, what the costs are. There may be, as Sheriff mentioned, with some things going on in their department, putting up some safety measures. Maybe it's some kind of plexiglass, or they have PPEs that they're doing, going to single serve packaging and one-time use menus, limiting seating. All of those things, they're having to weigh out those decisions. And I'd really like to thank the businesses for their cooperation and their continued cooperation as we move towards reopening the economy. There's been a number of things implementing different ingenious ways of helping to identify with social distancing, putting markings on the floor, having one-way aisles in some of the stores, and really taking it to heart as to keeping their employees and the public safe.
Second question, will businesses be allowed to have people's temperature checked, or will they be recommended to do so?
Well, the city can't require them to take the temperatures. That's not in our purview. However, their own business or corporation policies and procedures, they may be able to enforce that within there. And on the other side, the consumers have the option of voting with their feet, so to speak. If they don't feel that a business is doing enough to keep them safe, they may go elsewhere. And so I think there's that fine balance between what the businesses and corporations are doing to keep people safe and what residents and consumers are going to do to make sure that they feel safe themselves.
Next question, will the city or county consider or request or mandate individuals to use masks in public as other countries have done?
Well, similar to temperature checks, we're not in a position where we can mandate that, at least not at this time. Now, if something were to change as far as a proclamation from the governor or the state, then law enforcement may have to step in and help assist with that. But at this time, again, it still falls on the individual policies and procedures of the businesses and the consumers' thoughts and safety for themselves.
Next question, why are people camping in the lagoons?
Well, previously, the proclamation did allow for long-term camping for those that run campsites, for those that is their residence. But as you had mentioned earlier, with the updated proclamation from yesterday, May 6th, the new proclamation will allow for campgrounds to reopen with some limitations and restrictions starting on Friday, I believe, the 8th. So there you will see potentially some more camping, some of the weekend campers, so to speak. And we're doing what we can as far as the city and managing the campground to make sure that there is still social distancing, that common areas are kept clean. We will not have the shower house open at this point, so that's one thing. Most of these campers still have their own facilities inside, and so we'd encourage people to use those.
Have you received questions about rules on the houses of worship?
Early on we did, but that was still at the time prior to the more recent proclamation where people were allowed to have that. That was talking about the ability to have service from vehicles with windows down, things like that. And we had referred them back to the state and those things. With windows down, it didn't really necessarily, if cars are parked right next to each other, it doesn't meet that 6-foot distance. You're still open air. It's the same as if, I'm sitting within a couple feet of anyone in a room. And so we encourage them to follow the safe practices and guidelines. And now going forward, with the last week's proclamation allowing for religious houses to open. Again, it comes down to the decisions made by the individual churches, synagogues, mosques, you name it. They're going to have to decide if they feel that they're ready to open. Some of the worship houses had gone to online services, and during this time of uncertainty, they're still following that. Others are moving towards opening, and there again, it goes to the parishioners to decide how they feel and if they feel safe to go, following social distancing and other things. So a lot of it comes down to your own personal comfort and really being conscious of those around you.
Another group that probably realizes the silver lining, that utilizes technology well and perhaps maybe drawing people they wouldn't normally.
Found a new audience, and for those that might be homebound, being able to participate in a new way. Yeah.
Another win. What other advice would you have for us?
Well, I would like to say that as things open, it doesn't just mean everything's safe and we're all free from the virus. Making sure that people are still making decisions that are right for them. That when they do decide to go out, that they're being conscious of their surroundings and those around them. We encourage people to wear masks and any other protective equipment that they feel necessary for what it is they're doing. That they're keeping their distance from others. As we know, people can be asymptomatic and be carriers. And unless you know those that are around you, you don't know who might have other underlying health conditions that could put them at risk, if they were to contract anything. So definitely just making sure that we're continuing to follow everything we've been practicing the last few months, now and going forward. Definitely making sure that when you decide to go out in the public, that you do so, and just making sure that we're all very conscious for ourselves and those around us.
Thank you, Phil, and thank you for your leadership. And it's probably a little stressful being the new guy and learning a new role in a new city and working through us with us on a pandemic. So trial by fire, right?
That's right.
Next, we have some questions for our leader of public health, Linnell Deers, and I can tell you that I have a greater appreciation for the role of public health, as I've learned a lot working beside Linnell. Her and her crew, we spent all weekend together in the Emergency Operations Center, pulled in some retired expertise to help us make follow-up phone calls, and it's been interesting to see the backside of those operations that many of us don't see in public health. So Linnell, my first question from the public here is, are you advising people in direct contact with a person infected with COVID to self-isolate for the 14-day incubation period?
Yes, we are. It's called quarantine. So if someone has been exposed to someone that has been confirmed for COVID, we are telling those individuals that they must stay home for 14 days. Now, there are exceptions to this. Some of the exceptions are if they are a nurse, an EMS, firefighter, police, if they work at a meatpacking plant, those individuals can continue to go to work, but they must wear a mask, and the only thing they will be allowed to do is go to work and come home directly. The other caveat is during this 14-day period, if that person would become ill, then that person does go into isolation, and now isolation has been expanded from 7 to 10 days.
Our next question is in regard to the data we report every day, Linnell. And the question from the public is, I would like to know the amount of people that have recovered, and if once recovered, are those people numbers subtracted from the total number of confirmed cases?
Wapello County has had 8 people recover fully at this time. As for the total numbers, we do not subtract the recovered people from the total numbers that are reported, because what happens with disease reporting, we need to calculate at the end of the year how many individuals actually tested positive for that disease. So therefore, you will see that count continually going up with every additional positive case that we have of COVID.
Next question, will the criteria be adjusted to allow more testing?
I want to talk a little bit about that, because initially the testing criteria was very, very stringent. And the reason it was stringent is because we did not have a lot of testing supplies. So if you don't have testing supplies, you're unable to test everyone that should have been tested. Now we are getting additional sufficient number of supplies within our community and also within the state of Iowa. So therefore, the testing criteria is now being relaxed so more individuals may be tested for COVID.
Next question, Linnell, does Ottumwa Regional have the necessary PPE to cover this outbreak?
I'm going to refer back to what a wonderful job the Wapello County Emergency Manager has done in communicating regularly with the hospital and also the other healthcare providers and the clinics is part of that, the long-term care, the assisted living, all of this to determine where they are at in their supply PPE. If they felt if there was a shortage, he was able to put in orders up at the state level so we could get some additional PPE in the community. Currently, right now, they are able to order what they need, and their orders are now being fulfilled. So our community is in a better situation now than what we were about 4 or 5 weeks ago. We were all pretty stressed and trying to get enough PPE out to everybody that needed it. But I will also say, in regards to PPE, it depends also how many COVID patients you have, because if you are testing more, you're going to burn through more PPE, and that is going on right now, is that there's a lot more testing. So that means a lot more PPE is being used. We have been so blessed that none of our long-term cares have had a positive COVID case in there. But if they would get a positive COVID case in a facility, they will start burning through their PPE, so there may be a greater demand down the road.
Thank you for that, Linnell. And I'll supplement that by explaining that there is a order of priority with PPE requests. And obviously the healthcare coalition I described is frontline. So hospital, clinics, long-term care, EMS. Now that we're starting to get caught up a bit, we're now able to start looking at some of those other services that we were not able to supply before. You know, home health care agencies, dental offices, places like that. We'll be able to begin reaching out and see what we can help with. It maybe not be the full spectrum of what they're asking for, but at least we can help address some needs. And then we balance that with what's available in the open market. Linnell, the next question from the public is, why is only JBS being tested? Why not everyone with symptoms in Wapello County?
I think it is misinformation that only workers at one particular business are being tested in Wapello County, because the individuals that are being tested in this county comes from a wide variety of backgrounds, from a variety of businesses. This virus is community-wide. It is just not focused on one business within the community. In addition to that, if there are individuals that are symptomatic and meet the criteria, they need to go to their medical provider and talk to them, and more than likely they will be tested.
Next question, are positive patients being interviewed to try and identify potential locations in the community where they have frequented to establish where they may have been infected at?
Every positive test is communicated from Iowa Department of Public Health to Wapello County Public Health. Once we get that notification, we attempt to call the medical provider that ordered the test. And then we have a lot of questions that we ask that medical provider. And we also ask the medical provider, have you had a chance to talk to that person to let them know they have tested positive for COVID? I will say on weekends, sometimes we need to get a jump on things. So providers that were closed, we tend to go directly to the person that tested positive. After that, we contact the person that tested positive. We have a lot of tracking questions that we do ask them. And this also includes, we're now asking within 48 hours of you becoming ill, where did you go? And when I'm saying, where did you go? Did you visit Casey's? Did you visit Hy-Vee? Did you visit Walmart? Did you have a mask on? So these are some examples of some of the questions we are asking. We also ask, who lives in your household? And we get a complete household roster of who is living there. And are they sick? Do they have any symptoms? So we are tracking all of that. In addition to that, we ask them, is there any other individuals that you have been in contact within 48 hours of you becoming ill, and also after you became ill, that do not live in this household? If they give us their names and the contact information, we are contacting them and we are following up on them, because anyone that has come in contact with them is in quarantine for 14 days. In addition to that, we do work with these individuals in telling them it is important that they notify their employer, because we are not the ones that will be calling the employers, which has been a point of controversy that people feel we need to let that out in the community. And this is a directive from the Iowa Department of Public Health by code that we are not at liberty to give out that kind of information. I do want to remind people of Wapello County Public Health and the Emergency Management Directive, which is based on the recommendations of the Iowa Department of Public Health and orders issued by Governor Reynolds, that the public and many places of business and houses of worship are open with some restrictions. Private gatherings of more than 10 people are still prohibited, and social distancing measures are strongly recommended. On behalf of the Wapello County Board of Health, we strongly urge our community to please follow the service and guidance of those experts. These recommendations can save lives, and it is our responsibility to do everything we can to help minimize the spread of COVID-19.
That's all the questions I have, Linnell. What advice do you have for us as a community?
Well, there are several things we can do together to contain and prevent the spread of COVID-19, and common sense is still our best defense. Stay home if you are sick. Wash your hands with soap and water frequently. Avoid touching your eyes, nose, and mouth. Maintain social distancing of at least 6 feet between you and others. If you have to go out, go by yourself. Leave your family at home if at all possible, and wear a mask if you have one.
Thank you, Linnell. Next, I have some questions for Mayor Lazio from the public. Mayor, will the city consider request or mandate individuals to use masks in public as other counties and states have done?
Well, first of all, Tim, I want to thank you and your staff and Linnell and all the people behind the scenes. It's nice to be able to visit with our public rather than read to them or talk to them as though we were lecturing them. The question about the mask, I think Phil has done a great job already of answering that. We recommend that out in public, but we cannot mandate it unless if there is another order from the governor or from the Iowa Department of Public Health. I have mine with me. I carry it in my pocket, so when I leave the building, I'm in a pretty isolated office. But it does make a difference, and I think we're trying to set a good example, but we really want to educate people and help them to be responsible.
Second question I have from the public is the mayor involved in the city's response to COVID-19?
I certainly have been very involved, and I, again, appreciate the work the emergency management group has done. I know you and Linnell and a number of volunteers were in all weekend. I came down to the law center and checked in with you over the weekend. I've had daily contact with Tim and Linnell and Heather and some of the nursing staff. I really appreciate the fact that we have so many good volunteers in this community who have stepped up to the plate and are willing to help out. And just your tracking that you were just talking about takes a lot of time and energy. And it's very important that we do that, because I think while we've been concerned about the increased number of positive tests, we have to appreciate that people have contact with lots of other people, whether it's at shopping, whether it's friends, backyard get-togethers. And I think one of the things that came up the other night when we were talking with the long-term care collaborative was the fact that we have a lot of people whose partners, spouses, significant others, boyfriends, girlfriends are working at different locations. And so again, if you have a positive test, it's just a positive test. It doesn't mean necessarily that you are going to be spreading the disease, but we've got to pay attention to our long-term care facilities, because those people are very vulnerable, and we don't want to have an outbreak in any of our, with our senior citizens who are really at high risk. So again, I've been very pleased that while we've seen an increase in numbers, we've not seen a rush at the hospital, and we've not seen a requirement of more hospitalization. So I think people are paying attention and doing a good job of saying, let's do the things that we know prevent the spread. So again, following the CDC, the Iowa Department of Public Health recommendations. I know personally, I probably washed my hands more in the last two weeks than I have in the last couple of months. It's amazing when you just take that for granted. And again, another thing that we appreciate, John Deere came up with a device to open doors so you don't have to touch the doorknobs. Something I would never have thought about previously, but now we're paying much more attention. The fact that we have face masks and some of our business and industries have done a great job. And I want to be clear too that, there's been a lot of concern about meat packing and some of the situations we've encountered in our state. Our local provider is doing a great job of trying to be very safe, very proactive. They're one of about a half a dozen businesses that are doing thermal imaging and temperature taking. It's not just that location. So we are monitoring it, and we meet routinely. You've done a good job, Tim, of having a lot of Zoom meetings so we can all be together, whether we're physically together or on the meeting by electronic devices. So I think we are doing the right kinds of things. As you said in the very opening, this is a new experience for all of us. We've not had a playbook to follow, and So it really takes a lot of coordination, collaboration, and I think, again, I know I was on a Thursday Talking Points a while back with Dr. Rhonda Dennis-Smithart, and she's provided a great deal of experience and insight. Brian, can you help me? Quinn, thank you. I just blocked for a moment. So we're getting information from a lot of our local providers and medical staff, and some of the people who were in the room the other night have years of nursing experience. So we're tapping all of them to find out what we can do to prevent the spread and to minimize it, because we don't want this to become more serious. I think we're going to see more numbers, higher numbers. And I've said very publicly, we haven't peaked yet. We're just getting there. So I'm not so concerned about the number count as I am. Let's pay attention to the symptoms, and let's be sure we're getting proper medical care. And I'll just be very personal for a minute. In the month of April, I was sick for a little bit, and I questioned whether I had been exposed. I did talk to my local primary care provider, and after questioning and taking temperatures and so forth, eliminated it down to the fact that I just had a good case of the flu. But you wonder what's going on when you're not feeling good. And I did miss a couple of days coming into the office, which I haven't missed in several years. And so it is something that we have to pay attention. We need to pay. I think one of the things you just put out, and I know it's on your website, is a new symptom sheet that some of the things I've learned about the disease, and we are learning something almost every day, and it seems like regulations are changing daily and hourly at times. So I appreciate how hard it is for Linnell and some of our emergency service personnel, because when they get a call, they have to go and do the best they can. And so I appreciate our sheriffs and police and EMS people getting out and doing what we know is safe right now so that we don't spread this virus.
Thank you, Mayor. Any final thoughts or other advice for us as a community?
Well, I think, again, if people, and somebody already said it, common sense, let's be very pragmatic. Let's do what's in our best interest. Let's be personally responsible. It's going to change the way we've learned to live with each other. I mean, I still reach my hand out sometimes to shake hands, and I have to pull it back and think I can't do that right now. So, some of those things, the things that the sheriff talked about that they're doing at the law center to prevent, spread of droplets and particles at the windows and the plexiglass. Wearing the mask out in public, maintaining the 6 foot social distancing, washing our hands, staying home. If you're not sure, call and talk to your provider and get some professional advice. We all have a role in this, and I think we've got to really be sensitive. And I hope with this reopening, we don't get too excited and go too fast, because I think again, we haven't really peaked here in Wapello County. Yes, we have some high numbers, but we expected these numbers, and I think it's important that we really work hard together and help each other, educate and work with one another. We want to keep people safe and hopefully get through this very quickly.
Thank you very much for that. Just some closing thoughts from my viewpoint as emergency manager. To echo the mayor's sentiment about there's a huge team of people working behind the scenes in our community. And when we talk about a community response, that's exactly what it is. It's a total community response. You may not see a lot of forward-facing things. You see us here on Thursday night and we push out some press releases, but there's a tremendous amount of work going on behind the scenes, not just in the Emergency Operations Center, and all the public offices, but the hospital, the clinics, all those places providing services for you all. They're all working long hours. We're all working long hours. So the whole community's tired, and we get it. With tiredness comes frustration, but I would encourage you to remember this is a marathon, and pandemics don't resolve quickly. And this is not going to be over anytime soon. It may let up in the summer. We really don't know. These are uncharted territory. We can study the past. It's not necessarily a guarantee of the future, but we we almost live moment to moment sometimes, and we have to have constant conversation. We have to support each other as best we can. If you need mental health resources, reach out. We have tremendous resources in this community, and we have tremendous talent. And I think that's what's going to get us through this. From all the folks that are sewing masks at home, bringing us PPE, bringing food to different places, making phone calls for us, the healthcare providers that are thinking creatively and staying healthy so they're able to work their shifts. There's just a tremendous amount of stuff going on. And what we focus on a lot in the Emergency Operations Center is pushing out the information to you on our Facebook page, on our website, wapleready.org. And I'll give a little shout out to a couple entities that have really been huge. So the website is one. I worked last year before all this began to build a web platform with Ottumwa High School and their Spark Tank initiative. And that was as much of a learning process for me as it was the students on how to create a website. And that's been such a tremendous tool for us to use as a communications platform. So we encourage everyone to go to that. We post the numbers, our local numbers there every morning at 10 a.m. We post a lot on our Facebook page, which everything we post as a news item on Facebook, in case you don't do social media, is automatically pulled onto that web page under the news tab. So you can access that. So then we worried about folks that maybe aren't as internet involved. And that's where we took printed flyers to our grocers around town. I believe it was a week ago with the symptoms chart, just so we could reach all those folks as everybody goes to the grocery store. We have a new symptoms chart now because that has changed. We'll ask our grocers to do that again. And every one of them were more than willing to step up and do that. We're also working with employers that have folks that are here from other countries that maybe English isn't their native tongue, and we're working with them to try and translate that into their native language so they aren't missed either. So we're doing everything we can to try and get to folks. And if we're missing somebody, please reach out, let us know. We're always open to questions, feedback, concerns, those types of things.
Tim, I think one of the most important things we want to say to the citizens in general in Wapello County is that this issue about the difference in state reporting numbers and county numbers, and having worked with Linnell over the years and seeing some of the behind the scenes thing, I want to emphasize that our data is the actual verifiable data. There is a lot of duplication or misinformation. It gets translated back and forth. So tell people not to be quite as concerned. They can get on your webpage and you print that out. And I think it's just good information for the citizens to know that we check every one of those out, and sometimes the state jumps the gun.
And I'll have Linnell touch on her conversation with the state today. But what I tell people is to use that data as think of it as a representative sample. So it's impossible to test every single citizen. And even if we could do that and test every single one of our 35,000 people in Wapello County, that would be a snapshot of that moment. And what happens after that, you could develop the virus after that. But it's really just a meter to show us where we're at. Is it not, Linnell? Would you expand on that a little bit?
Yes, it is. Actually, when you get tested, it is a snapshot of where you are at that point of time. It doesn't mean that 2 or 3 days from then that you won't test positive for COVID. And in regards to the numbers, I've had some issues with duplications of cases in the queue that I get into from the State Health Department, and that has really skewed our numbers. And I have notified Iowa Department of Public Health to remove the cases that are doubled in there. So that explains part of it. The other piece of it is once in a while, I will get a case that actually resides in another county. So it takes quite a bit of time before they remove those numbers from our total statistics. And that also represents a number that is not actually a Wapello County resident.
Thank you. I'm sorry for the interruption. Just a final thought, as we try to keep on top of questions and concerns from the community, and sometimes maybe I get a little too distracted by some of the political climate of things. I know people's patients are being tested, but I just want to encourage people that it's no desire of any leader to take away your civil rights. And we have to limit some things to protect everyone. And nobody said we were going to stop this virus. That would be naive. We said we were going to slow this virus so it could run its course at a manageable level, so that we had adequate healthcare facilities, personnel, supplies, all those things to manage it and not have a surge so large that we couldn't care for people. And we had to start making ethical decisions on who got treated and who didn't get treated. there are larger communities that have had to do that. And there's probably nothing worse as a provider to have to be put in that position. And I said in our very first talking points here, why we're doing this. It's the 80-20 rule. So 80% of folks, they've told us all along, that get this virus will handle it. Make you sick for a while, but you'll bounce back. But there's 20% of our population, being our elderly, immunocompromised, other health conditions, that can't weather it and that have high risk of not surviving this. And those are the people we're doing it for. And we all know these people. We all have these people in our families. So they're our grandparents. They could be our parents. It could be siblings or children. And even if you don't have those, somebody you know or your friends do, and we need to think about those people. So it's not too far of an ask to ask you for a little inconvenience. Take it as a challenge and look at it as an opportunity to come up with new and creative ways. Look at some of the opportunities and silver linings that our officials here have taken on and made their office and services better. We all have that opportunity to do that in our daily lives, whether it's personal, business, church, other groups we're involved in. There's other ways to look at it than an inconvenience and an interruption to life. So those are my parting thoughts. We thank you for joining us. And if you continue to have questions, send them to us and we'll work them into next Thursday's talking points. Thank you very much.